Guys, I have discussion A for you this morning. Okay, we're discussing how older adults, uh, if your neighborhood is isn't adapting for older adults, face isolation, worse health, and higher costs. So that is today's discussion A. So let's get into it, please. All right, here. If your neighborhood isn't adapting, older adults face isolation, worse health, and higher costs. Fixed or fix but fix it by spot fix it by spotting gaps, organizing neighbors, and using proven age-friendly frameworks. What matters? By 2030, 1 in 5 Americans will be 65 plus. Communities that don't adapt see loneliness, unsafe streets, poor services, and rising care costs. What keep up looks like: safe mobility, walkable sidewalks, benches, transits, accessible housing, small, affordable, adaptable homes, coordinated services, outreach, home repair help, social programs, social connection, regular gatherings, intergenerational activities. What you can do in Vernon, PA: map gaps, sidewalks, transit, stops, groceries, programs, build a small coalition, neighbors, council member, area agencies on aging. Guys, so for things to work effectively for older adults, um, different agencies must come together in the future for people, for services. If we all come together as professionals, and we figure out what a elderly person needs for services, how they want their life set up to function, because it it's ultimately based on the person's the unique person. So you have to make services fit the person that you're servicing. So here we go with the rest of it. Next page. Okay, next page. Pick one quick win. Fix a sidewalk. Add benches. Start a weekly lunch. Use AARP's age-friendly model free structured proven, track simple matrix, fixes, completed, people reached, volunteer hours. Watch for doing too much at once, leaving out low income or mobility limited residents. Projects stalling with political turnover. And it also starts, guys, with elderly policy change. Some policies don't fit elderly people. So that is another area that needs fixed also. Okay, the other part of this, guys, is this article presents a development and planned evaluation of the neighborhood active connected intervention, a co-created neighborhood oriented strategy designed to improve physical activity, social connectedness, and digital literacy among low ES or SES older adults. What the article is about. The journal article, a neighborhood oriented approach to foster healthy aging and low societal economic older adults, development and protocol for evaluation through intervention. Mapping describes how researchers expanded an existing evidence-based physical activity program, Active Plus, into a broader community embedded intervention called Neighborhood Active and Connected, NAC. The goal: address the intertwined challenges of chronic disease, loneliness, and limited digital skills among older adults with low societal economic status. How the intervention was developed. The team used the intervention mapping, or IM, framework, a 6-step theory-driven process for designing health interventions. Key components include extensive needs assessment with low SES older adults and local stockholders, co-creation workshops to ensure cultural and practical fit, performance and change objectives, informed by literature and community inputs, adaptation of materials to improve clarity, accessibility, and relevance. integration of neighborhood ambassadors to support engagement and trust. These steps ensured NAC was not just a program for older adults, but one built with them. What NAC focuses on? The intervention targets three pillars of healthy aging: physical activity, expanding the original Active Plus program; social connectedness, reducing loneliness and strengthening neighborhood ties. Digital literacy, helping older adults navigate online tools and services. The holistic approach reflects the reality that mobility, social ties, and digital access are deeply interconnected. Detriments of well-being. Planned evaluation. The article outlines a large-scale cluster randomized controlled trial that will measure NAC's impact on physical activity levels, loneliness, social cohesion. Give me 1 minute, guys. I have paper stuck here. Health-related quality of life, digital literacy. Participants will be community dwelling, older adults living in both rural and urban, low SES neighborhoods. Why this matters. The study provides a replicable roadmap for communities and researchers seeking to design neighborhood-based healthy aging interventions. It emphasizes co-creation over top-down design, neighborhood context, a healthy determinants, intergeneration of physical, social, and digital domains. Systematic, not sold solutions. For communities like those you work with, this model aligns strongly with place-based equity, trusted partner engagement, and practical supports that meet older adults where they are. The elderly, active, and connected EAC protocol outlines a co-created neighborhood-oriented intervention designed to improve physical activity, social connectedness, and digital literacy among low societal economic older adults using the structured intervention mapping framework and a planned randomized controlled trial to evaluate its impact. What elderly active connected is? EAC as an integrational neighborhood oriented healthy aging approach developed specifically for older adults with low societal economic status. It responds to rising rates of chronic disease, loneliness, and digital exclusion among aging populations. The program expands the proven active plus physical activity intervention into a broader holistic model that also addresses social connection and digital literacy, recognizing that these determinants of health are deeply interconnected in low SES communities. How the protocol was developed. The research team used the intervention mapping protocol, a 6-step theory driven by a driven framework for designing complex health interventions. Key components included needs assessment with low SES older adults, municipalities, and local stockholders, co-creation workshops to ensure cultural and practical fit, performance and change objectives informed by literature and community input, integration of neighborhood ambassadors to support trust and engagement, adaptation of materials for clarity, accessibility, and relevance. This mirrors the development of the related neighborhood active connected NAC intervention, which similarly uses IM to build a neighborhood embedded holistic aging strategy. Oxford Academic. Core components. EAC focuses on 3 pillars of essential for healthy aging in disadvantaged neighborhoods. Physical activity, expanding the Active Plus Foundation. Social connectedness, reducing loneliness and strengthening neighborhood ties. Digital literacy, enabling access to online services, communication, and health resources. These components reflect evidence that low SES adults face compounded barriers across mobility, social networks, and digital access. Planned evaluation. The protocol includes a randomized controlled trial involving community dwelling older adults in both rural and urban low SES neighborhoods. Outcomes will measure physical activity, loneliness, and social cohesion. Health related quality of life, digital, digital literacy. This mirrors the evaluation design used in a NAC, which also employs a cluster RCT to assess similar outcomes. Why the protocol matters. EAC provides a replicable, quality focused roadmap for communities seeking support, healthy aging at the neighborhood level. Its strengths include co-creation over top-down design, integration of physical, social, and digital determinants, neighborhood and embedded strategies that meet older adults where they live, systematic, not sold, intervention design for your framework, especially your focus on family-centered frameworks, neighborhood equity, and practical supports for older adults. EAC aligns closely with the kind of place-based digital dignity-centered interventions you champion. Okay, guys, that is A for you. I will try and do another show for you soon. Tonight or later tonight. So I will be back on with shows later for you. For now, Gator Wellness, take care, folks.